We're moving a little posterior here. Anterior glenohumeral instability is extremely common. Posterior, not so common. And Chris has touched on posterior plus slap. It's only overall posterior about 2 to 10% of glenohumeral instability. And repetitive microtrauma tends to be more common. Atypical presentations can occur, pain, weakness, and a decline in athletic performance. So this is a classic mechanism. This is Australian rugby. I think a lot of you have seen this picture already, where the posterior force on the forward flexed humerus. The dislocations are rare, but this one resulted in a dislocation. This is a hockey player. I look after a lot of hockey players, so this would be a common situation where they'd go into the boards and dislocate their shoulder. But more commonly is repetitive microtraumas, sports such as weightlifting, football, even hockey, and laborers, military and police and firefighters. The incidence is about the same as anterior instability, males 8 times more common than females, and the same distribution more or less as anterior instability and ACL tears. But unique to posterior instability, because the microtrauma, you get a little bit of an older population with the laborers. So that's the epidemiology of the span of posterior instability. So what happens in posterior instability? This article by Matt Provencher's group when he was in the military showed that dislocation is extremely common in anterior instability. Posterior instability is less common. It's more actually pain that these individuals get. 90% get pain, and only a small percentage get actual instability. The posterior jerk test is one that most of us are familiar with. Sometimes patients will demonstrate posterior instability or do their own jerk test.